Did you know that your menstrual cycle can tell you much more than just the date your period begins? In fact, the cycle is a complex reflection of your hormonal health and can provide important information about your overall well-being. Many women experience changes in their cycle throughout their lives, but often do not understand what these changes mean or when to pay closer attention to them. Your menstrual cycle is more than just a monthly phenomenon. It is a delicately balanced interaction of hormones that not only regulates ovulation and menstruation, but also affects mood, energy, skin, and even bone health. A healthy cycle indicates a balanced hormonal system, which is crucial for your fertility and well-being. But what exactly does a normal cycle mean? The average menstrual cycle lasts about 28 days, but fluctuations from 21 to 35 days are also considered normal. More important than the exact length are regularity, the intensity of bleeding, and the absence of severe pain or other discomforts. Irregularity may indicate that your body is out of balance. Today, I want to show you what changes in the cycle can be important warning signals and how to better understand your body to intentionally support your health. The sooner you react to deviations, the better you will be able to prevent potential problems. Let's start with the basic phases of the menstrual cycle. The first phase, the follicular phase, which begins on the first day of menstruation and lasts approximately until the 14th day in a 28-day cycle. During this time, your body prepares for potential ovulation. The ovaries produce follicles in which the egg cells mature. At the same time, the level of estrogen gradually increases, which can positively affect skin condition, mood, and energy. Ovulation occurs around the middle of the cycle, approximately on the 14th day. At this time, a mature egg leaves the ovary and moves through the fallopian tube towards the uterus. After ovulation, the level of the hormone progesterone increases and prepares the uterine lining to receive the fertilized egg. During this period, many women experience a surge of energy. Their skin becomes radiant, and libido often increases. The third phase, the luteal phase, lasts about 14 days until the start of the next period. If fertilization does not occur, the levels of estrogen and progesterone decrease again, and the uterine lining is rejected, menstruation begins. Fluctuations during this phase can affect our mood, energy levels, and even digestion. Many women experience premenstrual symptoms during this time, such as breast tenderness, fatigue, or mood swings. Another important aspect of the menstrual cycle is the nature of the menstrual discharge. The color, consistency, and duration of bleeding can provide significant information about your health. Normal menstrual discharge usually lasts from 3 to 7 days. The blood is bright red or dark red, and small clots may form, which is usually not a cause for concern. However, note that if bleeding suddenly becomes heavier or lasts longer than usual. Heavy bleeding can lead to iron deficiency and is often a sign of hormonal disorders or benign changes, such as fibroids. Also pay attention to very dark or black blood, as well as sudden changes in smell or pain during menstruation. Pain during menstruation is also a concern that worries many women. Mild or moderate pain is normal because the uterus contracts to shed the lining. However, if the pain is very severe or lasts several days, it may indicate endometriosis or other gynecological conditions. In such cases, it is also important to consult a specialist doctor in a timely manner to determine the cause. In addition to physical symptoms, the menstrual cycle can also provide information about your overall health. Cycle disorders may be caused by stress, overweight or underweight, intense physical activity, or illnesses. Therefore, it is important to carefully observe your cycle and consult a doctor if any deviations occur. In addition to obvious physical symptoms, the menstrual cycle also provides valuable information about your hormonal health. If the cycle is regular and occurs without discomfort, it indicates that your hormonal system is in balance. However, if you notice unusual symptoms, it may indicate hormonal imbalance, which can affect your overall health. Typical symptoms of hormonal disorders include irregular cycles, absence of menstruation, or bleeding between periods. Severe mood swings, sleep problems, and extreme fatigue may also indicate an imbalance. Especially during menopause, hormone levels fluctuate significantly, which can exacerbate these symptoms. If you notice such changes, it is important to consult a gynecologist in a timely manner. There, you can determine hormone levels and discuss appropriate treatment options. Sometimes, restoring balance only requires a slight change in lifestyle, diet, or taking special herbal preparations. Contraceptive methods can also affect your cycle. Hormonal methods, such as pills, IUDs, or patches, alter natural hormone interactions and therefore may cause cycle fluctuations or changes in the nature of menstruation. If you change your contraceptive method or stop using it, your cycle may return to normal after some time. This may mean that your cycle becomes longer or shorter, irregular, or even stops completely. Symptoms such as increasing pain, mood swings, or fatigue may also intensify under stress. That is why it is so important to maintain a healthy balance between activity and rest. Relaxation exercises, such as meditation, yoga, or simple breathing techniques, can help reduce stress levels and stabilize the cycle. Regular outdoor physical activity also promotes hormonal balance and improves overall well-being. Additionally, take care of adequate sleep and a balanced diet. Healthy eating provides the body with essential nutrients necessary for hormone production and metabolism. Avoid excessive consumption of sugar, heavily processed foods, and alcohol, as they can cause inflammation and disrupt hormonal balance. Another important aspect of the menstrual cycle is observing the endometrial lining and cervical mucus. These subtle changes provide vital information about ovulation timing and fertility. In the first half of the cycle, the mucus is usually thick and sticky, almost like a protective layer. However, just before ovulation, it becomes transparent, elastic and stretchy, resembling raw egg white. Ten znak wskazuje, że Twój organizm jest optymalnie przygotowany do zapłodnienia. Kobiety, które monitorują swoją płodność lub planują ciążę, korzystają z tej zmiany, aby określić najlepszy czas na poczęcie. Nawet jeśli nie planujesz ciąży, znajomość swojego organizmu i faz cyklu pomaga lepiej rozumieć swoje zdrowie. If you notice unusual changes in cervical mucus, such as an unusual smell, color, or consistency, it may indicate an infection or other health issues. In such cases, you should consult a gynecologist for an accurate diagnosis and, if necessary, treatment. Observing your own cycle and the associated physical signals enhances body awareness and helps respond better to its needs. It is a valuable tool for maintaining health and early detection of potential disorders. In addition to the physical symptoms caused by your menstrual cycle, it also affects your emotional and mental state. Many women notice significant mood swings, changes in energy levels, and concentration abilities, which are closely linked to different phases of the cycle. These changes are completely normal and caused by fluctuations in hormone levels throughout the cycle. During the follicular phase, that is, in the first half of the cycle, many women experience a surge of energy and are in a positive mood. The increase in estrogen levels stimulates the production of serotonin, the happiness hormone, which improves mood and mental clarity. After ovulation, in the luteal phase, progesterone levels rise, which has a calming effect but can also cause fatigue and irritability. Premenstrual symptoms, commonly known as PMS, can occur in different women with varying intensity. Some experience only mild mood swings, while others suffer from intense emotional upheavals. It is important to learn to recognize these phases and develop strategies to better cope with them, whether through relaxation techniques, physical exercise, or a special diet. If the symptoms are very severe and interfere with your life, be sure to talk to your doctor about it. There are various ways to alleviate PMS and cycle-related discomforts, such as herbal preparations, lifestyle changes, or pharmacological treatment. Another interesting aspect of the menstrual cycle is its connection to fertility and the desire to have children. Many women do not know exactly when the optimal time for conception occurs. However, the cycle provides important clues that can be used to increase your chances or to intentionally plan pregnancy. The best time to conceive is the so-called fertile phase, which lasts a few days before and after ovulation. Since the lifespan of the egg and sperm cells varies, it is important to accurately identify these days. Methods such as cervical mucus observation, basal body temperature measurement, or specialized cycle tracking apps can help with this. If you have trouble conceiving, it is worth carefully documenting your cycle for a few months. and then discussing it with a gynecologist. Sometimes this helps to identify patterns or deviations that may indicate possible causes. Hormonal analyses can also be helpful. It is important to treat your cycle as a valuable tool that helps you better understand your health and achieve personal goals, whether it's family planning or simply feeling better. Mindfulness and knowledge are key to a healthy and conscious approach to your own cycle. Another topic, closely related to the menstrual cycle, concerns hormonal contraceptive methods and their impact on the body. Many women use birth control pills, patches, or hormonal intrauterine devices to prevent unwanted pregnancy. These methods alter the natural interaction of hormones and therefore can affect the cycle. As a result of hormone intake, ovulation is usually suppressed, which is why many women experience regular bleeding that is not in line with their natural menstruation. These bleedings are often called withdrawal bleeding. Side effects such as mood swings, weight gain, or skin changes related to hormonal fluctuations may also occur. If you notice side effects or are dissatisfied with your contraception method, openly discuss it with your gynecologist. There are many alternatives, and solutions tailored to your body and lifestyle can often be found. Regular checkups are especially important for early detection of potential risks. If you plan to stop hormonal contraception, you should know that your cycle may take a few months to normalize. During this period, disruptions may occur, but they are usually temporary. During this time, it is especially important to be patient and to carefully observe your body's condition. Finally, I would like to encourage you once again to treat your menstrual cycle as a valuable tool for maintaining health. It provides important information not only about your fertility, but also about your overall well-being and hormonal balance. By consciously observing your cycle and noting changes, you will be able to respond appropriately to shifts in your health. Use auxiliary tools such as cycle tracking apps or a journal to record data about menstruation, symptoms, and mood swings. This data can help you and your doctor better understand your body's characteristics and take appropriate actions if necessary. Remember that cycle disturbances are not always a cause for concern, but if you notice any unusual or concerning symptoms, consult a doctor as soon as possible. The earlier problems are detected, the greater the chances of effective treatment. I hope this video helped you better understand your menstrual cycle and take better care of your health. If you like this information, subscribe to the channel and turn on notifications so you don't miss important tips. Finally, I'm curious. What was the most important discovery for you in this film? Write to me in the comments. Take care of yourself and see you next time.